Dear Mr. President, you work diligently to help improve the lives of all American citizens. Some of the issues that you work to correct on are more important than others, but which issue is the most important?
So my concern is that we're going to continue to have more and more uninsured patients, and so we're going to have to continue to cut more and more services and programs within the healthcare institutions.
Despite the fact that many people in America agree that healthcare is a large issue, many also don't know the effects of Obamacare.
Well, Obamacare is a mandate put on both individuals and employers. On individuals, they have to get health insurance. They have to buy it from somewhere, which is really unusual for a government to mandate that someone has health insurance. But that's one aspect. The other aspect is it mandates that employers provide health insurance if they have 50 or more full-time employees, or they get penalized. Businesses are having to hire people just to figure out how Obamacare affects them. So that means they have to spend more of the money that they would have spent on their business or hiring new people, and hiring people to just figure out how is Obamacare going to affect them, and they probably are going to have to hire more employees just to do all the reporting that has to be done and figuring out what has to be done.
Even though the Affordable Care Act, also known as Obamacare, has a large impact on small businesses, there also are resounding consequences for the healthcare industry.
By the end of the decade, you're looking at a shortage of somewhere close to 90,000 physicians, and certainly going into 2025, somewhere closer to about a shortage of 130,000 physicians. And that's if nothing is done now to increase the number of physicians that we're training.
Even though the Affordable Care Act's effects are centered around small businesses and the health profession, it also has large impact on those in Washington.
It's going to have a devastating impact on the American economy, on fiscal policy, on the quality of American health care, and on healthy political discourse in the United States.
Even though Obamacare has its problems, there are also many benefits that citizens can take advantage of and use to their own well-being.
Well, I think to individuals, that let's say are sick, right now under Obamacare, they can't be denied for pre-existing conditions. So for the individual, I think that's a good thing. Well, I think to a factor of the people in America, they think it's good because they want more coverage. They want to be able to cover their adult children till the age of 26. They don't want any insurance to deny them with pre-existing conditions. So in that respect, it's a good thing. I just don't think our country can afford it.
But how does Obamacare affect regular people?
Well, my constituents are affected just like the rest of the country. They are now going to be mandated to have a health insurance, or they will be fined. They will be fined. And this is like the biggest tax increase on the American people, I think, in the history of America, Obamacare. So they are going to be affected, and businesses are going to have to be paying a penalty if they don't cover all their employees with health insurance, which will increase the cost to the consumers. So all in all, I think they're losing their freedom, and costs are going to rise for the individual, one way or the other.
Probably the best benefit of Obamacare for the individual is the mandate of healthcare, so that every person gets the insurance needed. But this benefit also has terrible effects that will eventually hurt the individual even more than the intended benefit provided by Obamacare.
I think that clearly the taxes are going to increase, because that is how it was ruled constitutional, is that it's a tax increase. So I think taxes will increase on businesses. Taxes have already increased. Different sectors are being taxed just to cover part of the cost of Obamacare. I also think that in the long run that we're going to have a shortage of doctors, because under Obamacare it actually cuts the amount that doctors and healthcare providers are going to get reimbursed through Medicare. And so at some point doctors are going to say, forget it, I'm not going to go into the health profession because they're not paying me enough. The government keeps cutting my rate. And so I really think we're going to have a shortage of doctors. I've spoken to doctors on this. who also share that concern.
I definitely think, we're going to have to, we're not, basically by doing this, we're going to have to just continue to go into more and more debt nationally. So I think the bigger focus is we need to figure out how to reduce the overall cost of health care.
The Affordable Care Act affects a wide range of people, from senior citizens to business owners to disabled youths. Although many who are affected by the bill benefit from it, there are also those whose lives are devastatingly impacted by it. Doctors face impairing fines and regulations, therefore resulting in a shortage of medical students, while small business owners face similar restrictions but with an added steep tax increase, causing firms to stunt their growth to keep costs down. But these are just some of the crippling effects of the Affordable Care Act. But what can be done to help ameliorate the results of these effects? Overregulated doctors may make their own costs more predictable and sustainable. This would lead to less cuts of payment, which is currently causing many medical students to no longer pursue the doctoral profession. Small business owners, on the other hand, could allow their employees a simple pre-tax dollar donation, which would allow them to purchase their own healthcare plan. This would reduce the need for owners to be mandated into providing healthcare for their employees, when that healthcare plan may not even fit the employee's needs.